In the northern region of Nigeria, traditional leaders play a pivotal role in community development and healthcare delivery. In a significant review meeting in Abuja, Northern Traditional Leaders Committee gathered to assess the progress of primary healthcare initiatives during the second quarter. Nigeria Today will look at the outcomes of this review meeting, exploring the committee's assessment of primary health care performance, challenges facing healthcare delivery, and the role of traditional leaders in their communities. The program will also examine the implications of this review for future healthcare strategies in the northern region. Thanks for joining us. I'm Ikaria Clinton. Now, with me in the studio to look at the second quarter review meeting by Northern Traditional Leaders is the Chairman, Northern Traditional Leaders Committee on Primary Healthcare Delivery, and the Emir of Argungu, His Royal Highness Samaila Muhammad Mera. You're welcome to Nigeria today.
Thank you. Thank you. Pleasure.
Now, also with us in the studio is Executive Director and CEO, National Primary Healthcare Development Agency, NPHCDA, Dr. Mui Aina. It's a pleasure to have you.
Good evening, Eucharia, and good evening again, Your Highness.
Now, before we go into the review, the outcome of the review proper, I want us to, to talk about the role of traditional leaders in the northern Nigeria currently, the role they play currently in promoting access to primary health care.
Yeah, alhamdulillah. Thank you very much. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والصلاة والسلام على رسول الله. The traditional leaders are the gatekeepers of our community, and they play a very significant role in the lives of our people. A traditional ruler is considered as a father to his community. He is revered, respected, and messages through him are highly effective, getting communities to change attitudes and so on. And primary healthcare has a lot to do with changing attitudes, the way we used to do things, to stay healthy and also to accept things that we may be suspicious about. So the role we play, one is to mobilize the community, to sensitize them, to educate them on the potentials, the benefits of accessing vaccines and the general PHC services Nigeria provides for the entire society. And we do that using the structure of traditional rulers. Traditional rulers in northern Nigeria have one head, and that head is His Eminence, the Sultan of Sokoto. Beneath him, you have like 200 to 300 first-class emirs. Beneath them, you have a layer of district heads. Presently, there are over 2,000 plus. And then beneath them, you have the village heads. These are in the tens of thousands. Then you have the ward head. Every community in Nigeria, no matter how big or small, has a leader, traditionally, and he knows where he reports. The structure is so simple. It is straight down for command and bottom up for reporting. So that's what we used. And because every community responds to that leader, messages from government, from agencies like the MPHCDA that we work with and other partners, gets easily accepted. So the role we play is, like I said, is to mobilize, sensitize, and educate people to accept new things, to accept programs of government that we believe will be beneficial to them. So it starts with us, actually. We were empowered with the needed knowledge to be able to communicate about these things with the people by MPHCDA and its partners. And with that knowledge, we go back to our community and cascade what we learned. So it is mobilization, answering questions here and there, attending to sensitivities and doubts in the best way we can, using so many tools to our advantage. Like I said, we're trusted, revered, we live within the community. And we start with our children.
Thank you very much, Your Royal Highness. Now, back to you, Dr. Tell us, why is the involvement of traditional institutions, crucial in improving primary health care?
There are a number of sides to the delivery of primary health care to our communities. On the supply side, you have the issues of quality of care. You know, you have the facilities, you have the health workers in the facilities, in the communities. You have the commodities and the processes for delivering that. On the demand side is the uptake of the services by the people who need them. Pregnant women going to attend antenatal care, pregnant women going to deliver their babies in health facilities, young children being brought to receive vaccination services. What we have found is that for demand to really work, for the uptake to be there needs to be trust. It so happens that the traditional institution is the most trusted mechanism that our people across many communities in Nigeria really have. The government in some places were trusted, in some places were not as trusted by the people, but they trust their leaders. They are with them in the communities. They know them. They relate with them. That's so we leverage this trust that the communities have in a number of ways. One is, like His Highness already alluded to, is when we need to pass messages across. You know, these are interventions that are coming. These are the benefits of these vaccines for your children. These are the benefits of these services for you as an individual. And even these are the costs if you don't access them. They are more believable when the traditional leaders are the one passing the message, or at least backing it up, even if you have also other platforms sharing the information. If the traditional leaders back it up and say, yes, this is true, we know, then it's seen, received with a lot more trust. As well, they also serve as the ears, our ears on the ground. They know how people are feeling. They understand what the true needs are. Many times when we offer or provide services, if it's totally top down, it may not match the felt needs of the people. You know, if somebody has a headache and you're bringing him a Band-Aid to cover a wound, a Band-Aid is good, but only for somebody who has a wound. But one of the things that the traditional institutions also do for us across board is to help us truly understand what the needs are and what will be effective ways to address those needs.
Okay, now let's talk about the review meeting that was held. You know, so tell us what were some of the outcomes of this second quarter review meeting on primary health care.
Meetings have been part of things we do. After every 3 months, we come together, especially when we have activities, be it just a vaccination round, or like we recently have an in-between round activity where you have so many things packed together, integrated. You have access to vaccines for malaria, for yellow fever, for diphtheria, and so on and so forth. So after the exercise, every representative of the state comes forward with a report, and he shares his experiences. What were the challenges in the course of the exercise? What were the good practices they felt promoted the work? And what the response was, what the coverage was, why people rejected, if there is rejection, and how many accepted, how many refused to accept, what they did to convince those who did not accept to come back and take it. So that's essentially what the review meeting is. It's like a peer review, program review.
How long has it been going on?
16 years,
16 years
last month.
Yeah, 16 years.
16 years last month.
So
I think.
What has been the impact of this review meeting? For 16 years it's been on.
The Northern Traditional Leaders Committee on PHC has been in existence for 15 years, and they have been active the whole way. We talk a lot about polio eradication today. 5 years ago, in 2020, Nigeria was certified free of wild polio and has stayed free. One of the things that the Traditional Leaders Committee, Northern Traditional Leaders Committee particularly, can take credit for is the critical role that they played in achieving that. And all of what we're doing now is really to build on that. Because at the end of the day, you know, the ability to reach hard-to-reach communities, to reach insecure areas, and get to people that are chronically missed, you can't do it without them. So they've really helped with that. Even right now, one of the things we're battling with are the issues of maternal mortality, but also coverage of routine immunization and what we now call the variant version of the polio. The wild polio is gone and hopefully remains so. But there's a variant type now that we're trying to get rid of. The traditional leaders have contributed in no little way to getting it down to where we are. As of this week, this year, for example, we've had almost 50% fewer cases than we had in the same period last year, for example. That's because of specific things we're doing in the way we're doing campaigns. We have now charged the traditional leaders with a number of things. One is to supervise the training of the health workers so that they can see that it's being done properly, to supervise the selection of the vaccinators in their community so that they're from there and they can hold them accountable. You know, they know they are their children, they know all the homes, but also when somebody rejects it, we bring the data back to them and they go and resolve what we call non-compliance. And those specific interventions are what is really causing a reduction in the number of cases that we're seeing. And you can extrapolate the same to other interventions that the government is doing, whether it is the maternal mortality, the attendance in ANC. You see improvements in many, many states, particularly in the north. And the reason is, again, because many of the traditional leaders have taken this on and are advocating for it and disseminating the benefits of getting appropriate hospital care when you're pregnant and when you're having your baby.
Thank you very much. We'll take a short break now. The conversation will continue after the break. And go away.
Is also dependent on another aspect or another arm of government.
Nowhere in the world will allow under digital economy for banks not to be dispensing domestic currency in that economy.
What will make this one different? We want to know what they do as occupation. All of these are attributes that our questions have been designed to investigate.
In a few days to come, you see that we are all around their own crannies and everywhere in Nigeria, telling people to cooperate.
Welcome to Nigeria Today.
Welcome back. This is still Nigeria Today, and we're looking at the Northern Traditional Leaders' intervention on primary health care. Especially in the north. So we have with me here two gentlemen. And Your Highness, the review, you are done with the review. So what are some of the challenges that you kind of noticed during this review?
Well, the normal challenges actually. Insecurity, hindering access to quite a number of areas in the north. Rejection, especially from the elites and some health workers and in the military, mostly from the elites. The general population have virtually accepted and have realized the benefit. Sometimes, again, the terrain makes it difficult for us to access certain areas. Such a challenge that has remained ever since the program started. So like I said, some of these challenges we see every day, but they change location. You may have insecurity here today, and tomorrow that place might be cleared by the security agencies, but the bandits might have moved to another place, to another state. These are some of the major challenges that were recorded during the last meeting, if I may say.
Thank you. So, while listening to His Royal Highness, I was thinking, how can we replicate this in other parts of the country? Because we're talking about the north. What about the south and other, regions?
That's a very good question, Eucharia. And I think a little bit of the context is that at the time that the NTLC was set up, the priority, the problems that were top of mind, wild polio at the time, and a few others were concentrated in the north. So naturally there was, the focus on trying to start and establishing there. However, what's in fact happened is that we have seen that no part of Nigeria is immune from the same issues. Vaccine rejection is very rampant in places, states like even Lagos, where we have a lot of elites and things, and many other communities. So we're in fact replicating that. Yeah, frankly, it has been replicated. At least there is a platform that has been put together now for the South-South, one for the Southeast and one for the Southwest. And I believe there's an umbrella platform that is also going to be for Southern Nigeria. So you will be hearing, Nigerians will be hearing a lot more about this. And we're using the opportunity of the upcoming measles rubella vaccine introduction to really, you know, rejuvenate this, because they existed before. They're not totally new groupings or platforms, but you know, we're re-energizing it now within the context of the campaign that we plan that is upcoming in October. So you will be hearing a lot more from them.
And there are some challenges that His Royal Highness mentioned. So how is the agency, how are they strategizing to ensure that these challenges are being addressed? Really?
You know, insecurity, I'll just take them one by one. Insecurity is evolving, but also is a substantial contributor to our inability to reach every community. To the extent that we cannot get our health workers to safely reach communities that people reside in, then you miss them. They miss out on these interventions. So we do a number of things. Again, starting with the traditional leaders. They know when it's safe to quickly go in. They know, you know, when it's less safe. So they help us using their local informants as well on when we can intervene and not. We also do have partnerships with the security agencies, with the Nigerian Army, with the Navy in certain places, and certainly with the police. We have civilian JTFs that sometimes accompany health workers as needed to some of the most difficult areas. In the worst affected areas, we've even worked with where civilians cannot go at all. We've even been known to work with military to go and administer the vaccines themselves. You know, we train them and they bring back information on what they are able to do. So that's the one thing. The second issue that His Highness highlighted was the issue of vaccine rejection and hesitancy. And more, like he said, we're seeing that among the elites because of the proliferation of misinformation. So the reason it's shifting from the poorest in our society to the elites is that the elites have more access to social media, and whatever false information anybody puts out there is disseminated faster. So what we're doing is working with our partners and within the government, and again, we're even in some conversations with the traditional leaders now to do our best to counter this, you know, to really not drown it, but at least counter, you know, the narratives, to put the true information out there and make it accessible to people. But this is also where partnership with the media is very important, you know. Appreciate platforms like this for us to share information, but also in your daily, you know, broadcast, it's also to put out information there that is factual, and people listen to what you're saying, and they take it very seriously.
Okay, Your Highness, you told us about the challenges, some of the outcomes. Now, what were your recommendations in all of these?
I thought Edie, in his last statement, actually responded to the question. But the recommendation is to embed this work within the community, so that we can work outside the period of a major campaign. Wherever it is safe, a village head, a district head can mobilize people to go and deliver the services needed by the community. And also to leverage on the security agencies, giving us cover to go in when it is needed, during campaigns or even after campaigns. So these are the two solutions we think can help us ensure that every child that deserves a vaccine actually accesses it.
So what other areas do you think the government can help, you know, to ensure that the members of a community have access to health care?
Yeah, you see, health care is not just about vaccines. We need to do more in the services that are accessible freely to the Nigerian public. people are willing to come to a hospital, but can they afford the services? Because in many places, hospitals are like consultant clinics. You go there, they assess what your problem is, and they give you a list of drugs you need to go and find yourself. So I think for this to move forward, for people actually to like to go to hospitals, they should be able to get some basic services, you know, free. Care for malaria, we used it during the last round, and it helped a lot in boosting the coverage, because people now know if you come to the fixed post with a sick child, you get the vaccine and you also get a care for your child. Many of our children are malnourished. In the last activity, Tom Brown, which is a fortified nutrition supplement, was made part of it by the government. And that alone, you know, drove people to come out. Take a vaccine, also take a pack of fortified nutrition supplement. That is used in the family not only by the child that it's meant for, but even his senior siblings. So if we can expand the services that are accessible in our clinics, in our hospitals nationwide, at very affordable or even free for certain things, I believe it will go a long way in making our job, the job our MPSDA and our caregivers do. Women going for antenatal will need to take fortified folic acid, and you know they could also do with some nutritional supplements if there are for women, because you see them, most of them emaciated, with little blood in their body, carrying pregnancy. So whatever services that can help, you know, make people want to come to see a doctor, I think will be welcomed by us, and I believe by the health institutions.
Yes, Doctor, I know, in line with what His Highness just said, you know, when you meet somebody, some of these people in the hinterlands, when you tell them, you talk about hospital, maybe somebody is sick and you say, we'll take them to the hospital, the first impression they have, it's expensive, you know. So is there anything the agency is doing to make these services affordable and, you know, making them want to go to the hospital and have this impression that, okay, I can afford it?
Absolutely. The government, not just the agency broadly, has a number of interventions that is aimed at addressing not just the quality of basic services, but also the affordability of it for the people. So there are a number of reasons why these are expensive. When the facility doesn't have the tools and the medicines and the equipment that it needs, then you have to go outside to run your tests, or you have to go and buy the medicines at expensive rates, or even simple things, gloves that the health workers need to take care of you. They ask you to go and buy it. One of the things that we're doing as part of our primary healthcare revitalization intervention is, one, improving the infrastructure of the facility so that it's decent and a bit, you know, it's not raggedy, that people don't want to go there. Two is to have the health workers that are trained and equipped. We're also supplying the basic commodities, at least starter packs that can then be recycled by the states, you know, as they are being used up. So as you provide many of these things free to the facilities or subsidized by the government, then the costs to people. Primary healthcare services are supposed to be free in many places. They are free, actually. We recognize that in a few places they still charge a token here and there. We're trying to address and remove that altogether. In addition to that, the government is working very hard through the National Health Insurance Authority to ramp up insurance. Insurance is sort of putting people in a risk pool so that when you go and access services, the insurance pays for it. And over the last year or so, there's been 4 million additional Nigerians nationally added to insurance. So we're also trying to ramp that up. So we're trying to fix the supply side to make it free, or as close to free as possible. And we're also looking at improving insurance through Vulnerable Group Fund so that people can pay.
Thank you very much, Dr. Muya. He's Executive Director and CEO, NPHCDA. Thank you so much for coming and sharing your thoughts with us. And of course, I have His Royal Highness Samaila Muhammad Mera. He's the Emir of Arugungu and the Chairman, NTLC, on primary health care delivery. Thank you so much for coming on the program.
Thank you.
And thank you for being part of the program. I'm Eucharia Clinton. Goodbye.